You're tired all the time. You've gained weight, your skin is dry, and you can't seem to think clearly. But your blood tests are normal, or so you were told. What if the real issue is hiding in a small butterfly-shaped gland in your neck? In this video, we'll unravel one of the most misunderstood and underdiagnosed conditions in the world, thyroid disorders. We'll cover the symptoms, signs, trigger factors, both medical and natural treatments, and we'll dive into the latest global research that's changing how we diagnose and treat thyroid problems. The thyroid is a small, butterfly-shaped gland located in the lower front of your neck. Despite its size, it plays a huge role in your health. It produces two critical hormones: T3, triiodothyronine, T4, thyroxine. These hormones regulate metabolism, heart rate, digestion, muscle function, brain development, energy levels, reproductive function. When your thyroid goes out of balance, everything in your body feels off, and many people don't even realize it. There are several types, but the two most common are hypothyroidism, underactive thyroid doesn't produce enough hormones, most common type, more frequent in women over 40. Hyperthyroidism, overactive thyroid produces too much hormone, less common, but can be more intense. Other conditions include Hashimoto's thyroiditis, autoimmune hypothyroidism, Graves' disease, autoimmune hyperthyroidism, goiter, enlarged thyroid, thyroid nodules, thyroid cancer. Let's break them down by hypo and hyperthyroidism. Hypothyroidism symptoms: fatigue, cold sensitivity, weight gain, even with normal eating, depression, brain fog, slow heart rate, constipation, dry skin and hair, menstrual irregularities, puffy face. Hyperthyroidism symptoms: nervousness or anxiety, rapid heartbeat, palpitations, weight loss, even with increased appetite, insomnia, sweating, hair thinning, frequent bowel movements, heat sensitivity, tremors, bulging eyes, and Graves' disease. Often these symptoms are misattributed to stress, aging, or lifestyle, making diagnosis tricky. Thyroid disorders can result from a mix of genetics, lifestyle, immune system issues, and environmental factors. Common triggers include autoimmune conditions, example, Hashimoto's, Graves', family history of thyroid disease, nutritional deficiencies, especially iodine, selenium, and zinc, radiation exposure, viral infections, chronic stress, affects adrenal thyroid axis, pregnancy. Postpartum thyroiditis is common. Certain medications, like lithium or amiodarone. In many cases, people develop thyroid issues slowly, and the body adapts until it's overwhelmed. 4. Hypothyroidism, levothyroxine, Synthroid, Euthyrox, a synthetic form of T4, taken daily, liothyronine, T3, sometimes used in combination therapy. It's important to monitor TSH, free T4, and sometimes T3 levels to get the dosage right. 4. Hyperthyroidism, antithyroid medications, e.g., methimazole, propylthiouracil, beta blockers, help manage heart symptoms. Radioactive iodine therapy, destroys overactive thyroid tissue. Surgery, thyroidectomy, partial or full removal. After treatment, some hyperthyroid patients become hypothyroid and need lifelong hormone replacement. While medication is critical, lifestyle support makes a huge difference. 1. Diet and nutrition ensure adequate iodine, but not too much. Include selenium-rich foods, Brazil nuts, eggs, tuna. Add zinc, magnesium, and vitamin D. Avoid soy, gluten, and heavily processed foods. If autoimmune thyroid disease is present, eat anti-inflammatory foods, berries, leafy greens, turmeric. 2. Stress management. Practice yoga, meditation, or breathing exercises. Chronic stress suppresses thyroid hormone production. 3. Sleep hygiene. Aim for 7 to 9 hours of restful sleep. Poor sleep raises cortisol, which disrupts thyroid hormones. 4. Exercise. Hypothyroid, gentle aerobic exercise, walking, swimming. Hyperthyroid, restorative movements like stretching or yoga to avoid overexertion. 5. Support systems. Join thyroid support communities, online or in person. Mental health support is important, especially with mood-related symptoms. 6. Avoid environmental toxins. Reduce exposure to BPA, fluoride, heavy metals, and endocrine disruptors in plastics and cosmetics. Let's look at what's new in thyroid science. 1. Gut-thyroid connection. Studies show gut microbiome imbalances are linked to autoimmune thyroid disease, especially Hashimoto's. Probiotics and gut-healing diets may improve thyroid function. 2. Genetic testing. Personalized medicine is being used to optimize thyroid treatment based on your DNA. 3. Brain thyroid axis. New findings reveal that even subclinical hypothyroidism affects brain function and mood regulation, especially in teens and postpartum women. 4. AI and thyroid diagnosis. AI-powered imaging tools are helping doctors detect thyroid nodules and cancers earlier and with more accuracy. 5. Immunotherapy. Experimental therapies aim to modulate the immune system in autoimmune thyroiditis, possibly reversing or halting the disease. Thyroid disorders affect millions of people, but they're often overlooked, misdiagnosed, or untreated. If you feel like something's off in your body and no one has answers, it might be your thyroid. The good news? It's treatable. You're not alone. Understanding your thyroid is the first step to reclaiming your energy, mood, and health. If this video helped you, like, subscribe, and comment below, especially if you've had personal experience with thyroid issues. Your story might help someone else finally get the answers they've been looking for.